Hello class, my name is Miriam Toledano. I'm going to be presenting a presentation on pap smear testing and HPV testing for cervical cancer. So first we're going to start with the importance of cervical cancer screening. Pap smears are highly successful in monitoring for any abnormalities, and in the event that anything is found, it can be treated early. So that's really the purpose of pap smears, is that to detect any cell abnormalities and being able to treat them prior to them developing cervical cancer. Most cases of cervical cancer occur of those who were not screened properly, and 50 to 64% of invasive cancers cases among women never screened or screened at intervals longer than 5 years. So that's the CDC, and this shows how important screening is. More than half of the people who were diagnosed with cancer, cervical cancer, were not screened. The demographics, our target population is women ages 21 to 65. Cervical cancer at early stages is asymptomatic and easily treatable when discovered early. So they always have that asymptomatic phase where if they detect anything and go through treatment, it significantly reduces morbidity and mortality. 11,700 new cases occur each year, with Hispanic and African American women being affected most. Genital HPV is a risk factor in developing cervical cancer. Therefore, education on proper contraception use is critical. This is especially true since HPV is usually asymptomatic. So again, we have the asymptomatic period where if treated, we can prevent mortality. So screening. Women ages 21 to 65 should be screened every 3 years, but women ages 30 to 65 can be tested with pap smear and HPV testing every 5 years, if that's what they prefer. Screening is not recommended for women under age 21. As per the U.S. Preventative Services Task Force, it does not reduce cancer incidences and mortality, so there's really no point in screening under 21. Women over the age of 65 who have had adequate prior screenings do not have to be screened. Exceptions are those who have had gynecological surgery due to cancer or a history of high-grade precancerous lesions. So 21 to 65 is really the years that anyone should be screened. A pap smear, so the procedure, which is the pap smear, it's when an instrument is inserted into the vagina to remove cells from the cervix, so they can be looked at under a microscope for cell changes that can lead to cervical cancer. A pap smear is not only able to detect cervical cancer, but infections and inflammation can be detected as well. HPV testing looks for presence of high-risk HPV types in cervical cells, and this test can detect HPV even before cell abnormalities are evident. And then you have a little picture of what the instruments look like that they use for a pap smear. So the effect on quality of life. The 5-year survival rate of cervical cancer varies greatly depending on the stage in which it was found. According to the American Cancer Society, the variation is from 17% to 92%, with all stages combined yield a 66% 5-year survival rate, which is pretty good. 66% of the people that were treated have a 5-year survival rate. Quality of life will depend greatly on the stage in which the disease was discovered. The patient can potentially require surgery or chemoradiation, enduring all side effects that will accompany those treatments. But if found in the precancerous stage, the cells can be removed with excisional or ablative treatment and yield much better results than waiting until later stages. So again, the effect we have on detecting early, and that is why pap smears are so important. According to the National Cancer Institute, pap smears reduce cancer diagnosis by 80%. Reliability and validity of testing. According to the National Cancer Institute, pap smears reduce cancer diagnosis by 80% if the lesions are treated earlier. Pap smear has 83% sensitivity and 98% specificity. And HPV sensitivity varies from 91 to 99% for HPV DNA and 62% to 67% for HPV mRNA. So that's also a pretty significant percentage of reliability and validity of this test. Treatment in the asymptomatic phases. So treatment will depend on the level of cell abnormality found. According to the American College of Obstetrics and Gynecologists, there are cervical intraepithelial lesions which are used to determine stage. So there are 3 stages of CIN. CIN 1 is changes that usually go away on their own. CIN 2 and CIN 3 are considered precancerous. Some will require further testing, such as colposcopy, biopsy, and endocervical sampling. There are 2 ways to treat abnormal cervical cells. So one is the excisional treatment, such as LEEP or conization, and 2 is the ablation treatment, such as cryotherapy or laser therapy. Cost and availability. Most insurances will cover Pap smears with no out-of-pocket costs. You might have a copay, but they're fully covered. If you meet income criteria, the CDC offers an interactive map that will show you where free Pap smears can be obtained. So there are some criteria that you have to meet, but there are, if you are low income or uninsured, there are ways for you to get free Pap smears. And most offices or Planned Parenthood offer low-cost Pap smears to the uninsured, and ranging from $33 to $165. So even for people who are uninsured or low income, there are ways for them to get their Pap smears done. Ethical, economic, and legal issues. So there's always a risk of false positives and false negatives. There is a risk of requiring unnecessary invasive procedures for low-grade lesions. This can cause fertility issues at pregnancy complications. So if there is one that's inconclusive or a positive and they want to do some additional testing, that can always put you at risk for fertility or pregnancy complications. Psychological effects are also something to be taken into account. Women can have severe anxiety from positive tests or waiting for additional screening, or even false positives. So standard of practice, the American College of Obstetrics and Gynecologists have guidelines for cervical cancer screening. And after talking to local practitioners, it seems like the guidelines are really followed and patients are offered surveillance when indicated, like low-grade lesions or colposcopy with endometrial sampling when they have high-grade lesions. And cancerous lesions are biopsied in the OR. An HPV DNA test can be has been approved by the FDA to be used without a Pap test to screen for cervical cancer. And the problem is that Pap smears don't pose that much of a risk, so they're really still used as the standard of practice. So I hope you enjoyed my slideshow on the importance of cervical screening and Pap smears and HPV testing. Thank you for listening.